First, I'd like to welcome everyone to the Clinical Research Professional Training Series, January 2021. Hope everyone was able to have an uneventful and joyful holiday season, but it's time for everyone to get back to work. We have a lot ahead of us for this year, but first I wanted to start off talking about Clinical Research Professional Certification and what that means to everyone, whether or not you should get certified. If you do get certified, there are many options out there. So we're going to talk a little bit about that. I hope I have left some time at the end of the session, today's session, for you to put in some comments or questions. If you'll just type them into the chat, Rachel will help me get through them at the end of the series or the session, and we'll try to get those answered. It may be possible that I do not have the answer, but I will get the answer if I do not have it at this time. So some of the objectives for today are to discuss why individual certification is important both to the individuals and to our industry, to review some certification eligibility and renewal policies of ACRP, SoCRA, and some others. And I will be discussing some other certifications that can apply to clinical research professionals, and we'll get into that a little bit later. So what is the purpose of certification? Certification ensures that certain standards or competencies have been met. They reflect that the individual or institution's commitment to excellence. Certification also implies that a competency rather than just a knowledge. With regards to clinical research certification, it is shown, research has shown an improved protocol adherence, clinical research quality. It also helps to standardize the processes and procedures and terminology between studies and between different sites. Certification renewal, again, demonstrates a personal commitment to quality research and reduces the variance within clinical trials. And as I alluded, there have actually now been studies looking at how certification assists the CRCCs, the CCRCs, and clinical investigators. A study by John Mark Hausler that looked at back in 2008, looked back at some studies comparing those that were certified with those that were not, broke it down into uncertified coordinators, uncertified PIs, and then trained coordinators and trained PIs. And actually found that there was statistical significant reduction in the number of protocol deviations when either and then both of the CCRC and the PI were certified. So the push for certification has been something within the last 10 years. When I first started research about 12 years ago, it was an option. But I really do feel that it sets a standard for all of the clinical research personnel within the industry to show their commitment to providing quality research. Other studies have shown that there can be an increase in randomization rates. And then there was a study looking at certified investigators that actually received fewer for-cause audits. And when those audits were called, that there were fewer findings when the investigator was actually certified. And that there have been some studies that have shown that just doing GCP training via city that we all have to do in order to get on an IRB, that this is not the same as being competent. And so I think that that is one of the things that is a little confusing to some, as our certificate is not the same as certification. A certificate is usually the result of going through a series of educational learning. You may have assessments along the way to see if you're understanding the learning, where certification implies that there's been an exam where you have had to apply that knowledge base. I often use the analogy, which really is very fitting as far as clinical research goes. It's the driver's education. I actually have, my husband works in driver's education as a second job in his retirement. In the classroom, the student learns the rules and the regulations. Doesn't mean that they know that, it doesn't mean that they can drive a car, but it does mean that they understand and have a knowledge of the rules and regulations around it. But it is actually the road experience and getting out and getting behind the wheel that gives them the competency to apply all of that information. They're given the exam, certification exam, and then they are certified. Thus, they get their real driver's license. Clinical research is much the same way. There is a time when you go through and you learn all the rules and regulations, you have a knowledge of. Someone asks you the definition of a term, you can give it to them. But certification then implies that you can actually apply it. That is why some of the certification exams for the various societies can be rather difficult, because you are asked to apply that knowledge. Given a scenario, what is the best outcome? What is the best procedures based on the rules and the regulations that are provided? So some of the most well-known certification choices to clinical research professionals. Everyone will be getting a copy of the slides today. So each of these are links to the different certification choices. Association of Clinical Research Professionals and the Society of Clinical Research Associates, the ACRP and SoCRA, are two of the top certification choices for clinical research coordinators and professionals that are actually working in the clinical research trials. Society of Regulatory Affairs Professionals, or RAPS, is one that is sought by a lot of those that are working strictly regulatory. There's also the International Association of Clinical Research Nurses, which is ICARN. And then most recently, I discovered the CDMP, which is a clinical data management profession, which is handled by DAMA International. So we'll again kind of be going into some of the more details of these today. So Association of Clinical Research Professionals. It is not first because it is the one of choice. I went alphabetically for these two. Association of Clinical Research Professionals was originally established back in about 1990, 1991. Currently has about 13,000 members over 70 different countries. It is probably one of the best known for those working in the clinical side of the clinical trials, especially those that are not cancer related. SoCRA seems to be the one that those working the cancer trials do more often. So the eligibility, and this is similar across the board in the sense that there's usually so many hours of experience that you're supposed to have before you even attempt the certification. Again, think back to the driver's ed. How much time have you had behind the wheel before you go for your certification exam? Clinical research professionals, ACRP, requires 2 years of experience in clinical research or 3,000 hours within the last 10 years. So this is where they're talking about full-time versus part-time experience. They also will include combinations, and if you have so much education at a higher institution, academia, have so much education there, that will count towards some hours, but they still want to see at least a year to 2 of experience, time behind the wheel. And they also specify what those years of experience have to be within. And if you go to their websites, they will drill down more into what will count towards the experience. Much like when you're transferring colleges, which credits will transfer and which will not. The exam was offered twice a year through the Prometrics, which are set up testing centers. But due to COVID, this year they have started an online option. Exam fees are typically about $460 for members, $485 for non-members, with membership being approximately $160 a year. Again, they offer some early bird discounts that if you put your applications in by a certain time, you get discounts. Renewal for ACRP is every 2 years. Requires 24 hours of continuing education in order to renew, and the application fees are $250 or $325 depending on membership. These continued education hours do not need to be continuing medical education or continuing nursing education, but continuing education hours, much like we provide for the CRPTS series. Some other things that ACRP has gotten into is that they offer several different levels of certification. So they have the Clinical Research Associate, Clinical Research Coordinator, and then a certification for the Principal Investigator. They have now also introduced some subspecialties. These fees are somewhat the same as if you were renewing. So if you already had your CCRC and it came up to time for renewal, you could renew as one of the subspecialties if you had the experience and qualified for them. And so that was in Certified Professional. This is one that is based more off the ICH guidelines, so including a little more international information, medical device subspecialty, and then also a project management subspecialty. Again, these are just step ups from your basic certifications for the associate, coordinator, and investigator. SoCRA, on the other hand, couldn't quite find when they were established, but I know that they've been around for quite some time. Their current membership is about 16,000 members, 12,000 which are actually certified. Certification in SoCRA is usually designated as a CCRP, a research professional, as opposed to the CCRC, which is the research coordinator, which is ACRP. The eligibility is again 2 years of full-time clinical research experience within the last 5 years, as opposed to 10 years for ACRP. And that if you were part-time, it also has to be within the last 5 years. Again, they will use academic degrees or certificates issued by the higher learning education towards your eligibility hours. And again, they do define what those clinical research hours have to be under. They do stipulate that it has to be under good clinical practice, GCP, rather than the GLP, the lab, or the manufacturing. Exam fees are less than ACRP at $395 or $450 for non-members, and their membership fee is $75 per year as opposed to the $160. The one thing that they also offer is that when you go to renew, the membership fee is automatically included in that fee that you pay for renewal. Again, They have also started an online exam due to COVID. Typically, exams are held at various sites across the nation, and that different institutions can request that a exam be conducted on their site. Since I've started in this position, I have tried to schedule several of these SoCRA certifications, but unfortunately COVID has prevented the use of any of the institutional rooms in order to hold the exam due to COVID. Renewal for SoCRA is every 3 years with 45 hours of continuing education, whereas ACRP was 2 years with 24. Their application fees are $350 for 3 years. And again, their membership cost is included within that membership, the renewal fee. Another note to make is that SoCRA does offer payment plans for taking those application fees and spreading it over a 3-year span. It does cost a little bit more, but the out-of-pocket and the cash flow is a little bit smaller. So those are the two biggest ones, SoCRA and ACRP, for clinical research coordinators and those actually working within the field with the patient's recruitment. But you cannot have clinical research trials without regulatory affairs. And so that's where RAPS comes in. This was actually established in 1976 as a global organization. It has over 225,000 memberships across the world. Their eligibility is 3 years of regulatory experience with the bachelor's degree, and then the years of experience required goes down as a educational degree goes up. So 2 years with a master's or 1 year with a doctorate. Examination fees are $485 or $605 based on membership. Their examination is offered 3 times per year. And the membership fee is either $220 or $420 for a 1 or 2 year membership. In reading about the RAPS, they actually have both they offer the certification exam, which is similar to SoCRA and ACRP, but they also have on their website a certificate program because they offer so for the 3 years of regulatory experience with a bachelor's degree, if you do not have a degree, you can get a certificate, which will take the place of that bachelor's degree through their society. And they have one that is specified as to drug specific, device specific, or a dual certificate that covers both drug and devices. These are anywhere from 9 to 14 hours of courses, different courses over 6 or 12-month periods. And the certificate costs are anywhere from $3,000 to $5,000, depending on whether you go single or dual. Now, again, these would be the certificate, much like getting your temps for doing the classroom on your driver's ed, but then you would have to take the certification test on top of that in order to get the certification or your permanent license. Renewal is every 3 years with 36 hours of continuing education. The recertification fees are $180 per member or $290 for non-member. As far as those working within the clinical research profession, I would say that this is something that if you are working specifically for an IRB or your job is strictly regulatory affairs, this is something that would be something you might want to look at. If you are working in just the clinical side as a coordinator, this is probably not something that you need, as it would probably include a lot of information that you would not be required of you. One of the other things that I've become aware of is the International Association of Clinical Research Nurses. This is something that Dr. Carolyn Jones, who is the director of the Masters of Clinical Research program here at Ohio State, and also my mentor and supervisor, is very big on. If you are a registered nurse, this may be something you would want to look into. The certification is a little different in that in order to even be classified as a clinical research nurse, there is an application, a 4-part application, where you have to document both continuing education over the last 3 years and also document professional development within the last 5 years through a combination of points. Once you have joined with this presentation of documented as a member, then you will be renewing at every 5 years after that. So it's a little bit different in that you're also not just showing experience within the field, but that you also are having to demonstrate an experience at the nursing level as well. Eligibility, again, for the exams, cover information presented on the screen. Oh, no, this is a different one. Let's go back a second. For the International Clinical Research Nurses, this is something that I would encourage our registered nurses to maybe look at as far as being able to have that CRN after your name, or the CCRN. I think that it really speaks to the quality of our nurses working within the clinical research fields. And then the last certification I wanted to talk to you about, oops, I went the wrong way again, I'm sorry, is the data management. We had talked a little bit about it last year when talking about data management. And since then I've looked into it to get more information. Eligibility, this one is a little less like the driver's license in the sense that you're not documenting experience. They have a booklet that you need to be able to go through and show that you know how to do these things. Their certification is $311 per exam. These are all online. And these are the different areas of data management that you can be certified in. And then their membership fee is $50 per year. And their renewal is going to be every 3 years, but I guess this is new enough that they haven't released the information on what their renewal process will be. I think that having renewals are important as it shows a continued effort towards staying up to date within the given fields. So those are the data management or the certifications that I am aware of. That is my one caution to everybody, that before going into and putting the work towards a certification, make sure it's one that is applicable to your field, that it is going to help you do a better job and quality. Just assembling a list of alphabets after your name is not really what we would want to see. We want to see purpose behind the certifications. So the next question I always get is, well, what do I need to know? What do I need to study? So again, you go back to what are the information conveyed during your classes for driver's ed, rules and regulations, but that doesn't always help you in applying that information. That is through experience or working on scenarios, making evaluations. So here is a list of things combined from ACRP and SoCRA. ACRP is in red, SoCRA is in the black. The difference between the two is that clinical ACRP, or the clinical research coordinators, tends to be more ACRP. Those that are working in the cancer trials, because there is a bigger difference between, there's a bigger regulatory aspect in the clinical cancer trials, they tend to go more for the SoCRA, because a lot of times their trials are inpatient trials, or they are things that are given in the hospital where they end up working with a clinical research nurse. So that's where there's a little bit of difference, other than the monetary differences. However, I would say that anybody that is studying for anything related to clinical research should know all of this information. Everyone should be aware of the Nuremberg Code, the Belmont Report, and the Declaration of Helsinki. What they are, what they mean, how they formed where we are today. The codes of federal regulations are actually the FDA's and our government's way of listing out what the ICH has put into practice. Also knowing the ICH protocols and guidelines. These are the international rules and regulations. And the Code of Federal Regulations are the US parallel of those regulations. Within the field of clinical research, you need to be aware of your ethical and participant safety considerations, investigational product or devices, GCP, clinical operations. Everybody should be top of the class in GCP. GCP is something that you should review every year. I tend to think that you need to review it every year in the sense that you have different studies each year. So each time you start a new study, the way that you're going to apply GCP is going to be a little bit different. Understanding the basic concepts of the science and research design, again, only help you perform at your top levels. And then having some information about data management and informatics, again, helps you be that key piece in the puzzle that is being assembled during a clinical research trial. So with all of that being said, then the next part comes about funding it. If you're like me, $400 is a big chunk at given times, especially if you have family and kids, and even if you don't, just starting out. So I do know here at the OSU that some of the departments will cover the costs of the initial exam fee. This is usually as a reimbursement. They don't want people taking the certification and not putting in the proper study time and things like that. But they will cover that initial exam fee. But then the renewal fees and membership fees are up to the employee to pay as they are needed. If a department where you work is not funding it, there is the OSU Staff Career Development Grant. This is something that OSU offers. This here is blue is a link that you can look at later. It does have a grant that will help cover the cost of either travel, if you wanted to go to a conference, not that we can travel anywhere at the moment, but that they can offer some reimbursement for those fees if you qualify. One of the things that I didn't realize is that they can do it as an individual of $1,200 for an individual or $1,750 for groups of 2 or 10. So what you could do is that if that was something that you were going to seek, is that a group of you could get together, and probably be about 3, that you could put together and apply together to get certified. This may be a better way to approach it. It's on a reimbursement basis only. So you would have to pay initially, but then be reimbursed for it. Eligibility is at least 2 continuous years of employment at least 75% FTE. But there again, in order to be eligible for most of these exams, does require the 2 or 3 years of experience. So that would be grouped in with it. So I did want to conclude this a little bit early. So if there are any questions, please go ahead and put those in the chat and we can take a look at them. Again, I would say that certification is essential to clinical research professionals. One of the things that you see is really that demonstration that you are no longer that student who has never been behind the wheel. This indicates that you have that knowledge of how to apply the regulations and the guidelines that are out there. It also states that you are keeping up to date with the various certifications that are out there. You're keeping up to date with changes. I know that both SoCRA and ACRP have been very big at keeping everybody up to date with changes due to COVID. So some of the questions: can I apply for the OSU Career Development Grant to renew my certification? You might put in for renewal. I don't know that they would cover it. Typically, it is only the initial exam fee. If you are having trouble with the renewals, I would definitely speak to my supervisor. It is institutionally a benefit to the institution to have certified professionals working within their research field. ACRP on their website actually has some information about how to justify the costs of certification and, I guess, renewal to administration. So if you want to, you can try that. Are there any additional requirements other than experience for ACRP or SoCRA? Well, I think most of it is based on that. It is based on experience. What they do is they allow for some education. So if you took an education class at OSU that pertains specifically to clinical research, such as the Masters of Clinical Research, those classes would count towards that experience, but that will only count so far. Almost across the board, they would allow some education, i.e. classroom type education, to count towards eligibility, but almost all of them still require some of the on the ground, behind the wheel experience to demonstrate a competency of that information. And that is where the difference comes in. As far as the one, are there any restrictions in terms of US citizenship or permanent residency to take these? No. Almost all of these are international, so that it does not apply to which country you are in or where your citizenship lies. It just requires the experience and the knowledge. If I switch from ACRP or SoCRA to ICARN, do I have to re-exam? Yes. The ACRP and SoCRA would count towards your eligibility, but they would still want you to re-exam because it is basing it on a nursing aspects of clinical research. As far as the next question, can they make any exception regarding the experience for someone who has a little less than 2 years of experience but has a medical degree? that may be something, I would say they may, with regards to what that medical degree was in, and also what the years of experience, what you were actually doing. So they will take on, you know, case by case applications when you do have a rather quirky work history. So I would definitely look into that. The other thing that you might be able to do is to look at perhaps applying for the CPI, the Certified Principal Investigator. I don't know how that would differ. You have to, when do you have to apply to receive the early application discount? For for ACRP, I believe it's usually around a month early. But again, some of it may have changed since they went to an online system as well. But typically it's usually early bird specials are usually 1 to 2 months ahead of time so that they don't get a slew of applications all at once. It kind of spreads it out a little bit. But if you go to the website, it will give you those actual dates that you need to apply and what the early birds are. Okay, the next one was medical degree and Masters of Science. Now a CRC at OSU and want to get into more clinical research administration jobs. I would say that for that, you may want to look into the RAPs, the RAP, because that is going to be more regulatory based. Clinical research administration is a little more along the lines of the regs and how to administer and grants and things like that. There is actually a research administration group at OSU, and I will send that information to you. I saved the chat notes, but that may be something that you can look into as well. They have some education that is offered usually in the fall of each year, and I can send you that class information as well. And so that might be an option for you, is to start working in that realm. And again, if you start working in that realm and your name gets known, then when those positions open up, they're usually more available. I think that almost every group would prefer to hire from within. Okay, the next question. Any content difference between ACRP and SoCRA? And you are correct. ACRP usually does include more of the clinical questions than the regulatory, as SoCRA does. So ACRP will ask more questions along the lines of asking you, you know, figure out a dosing scheme. You know, if you're supposed to give it so many times, what would you recommend? There is sometimes math included on the ACRP. Yeah, it's based on that information that a clinical research coordinator, someone who is seeing the subjects and conducting those follow-up appointments, is going to need in order to pass the exam. And I am hoping that starting, I know that they've gone to the online examinations, but typically it's usually spring and fall that they offer the exams. And so I'm hoping that I can start in March and in September offering some not training classes, but more of a mock exam type classes of where we'll go in and in a workshop, start asking some questions and forcing you to apply the information that you've been studying to help prepare for the exams. I think sometimes that was, for me early in my career, was that we would sit in groups within offices. There's usually 4 in an office with the more experienced individuals in the office and the less experienced. And so you would learn from one another how to apply the rules and regulations in your day-to-day working. Is it recommended to get both ACRP and SoCRA or either one? I think that I have found that one certification works. Being a member of both is probably of more benefit, a little less costly also, in the sense that both present very pertinent information, education offerings, seminars, webinars, journals, that you really can get a good cross-section, both the regulatory and some of the clinical. If you're working in a truly regulatory entity, even knowing some of the ACRP information, what is going on in the clinical space, is helpful to you. Next question. Which certifications do most employers like to see if they prefer or require one? That's a little difficult. I think that, again, whatever field you're in, if you are really working on the clinical research side with the subjects, I tend to think that the ACRP is a little better representative of what the information is that you're going to be required to put forth. If you are working on more of the regulatory aspect, I think that the SoCRA does have more information available regarding changes within guidelines and things like that. It is hard to say. I do know that overall, SoCRA tends to be a little bit more for your money, or they charge a little less, but they don't include some of the clinical information that is sometimes required. And so, are there any review guides available online, review courses for either ACRP or SoCRA? Yes. Both, almost all of them have information, and that's why I included the links. If you go on to them under their certifications, they almost all have some type of document instructing you as to the content that they're going to cover in their exam. Some of them even go down to the percentage of questions you'll receive in a given area. One of the other things to always be cognizant of is the Joint Commission's competency for regulatory, for clinical research. Those are also something that, as an educator in clinical research, I follow, because these are what have been put out there as the standard competencies for individuals within the clinical research profession. And yes, study groups with the guides. You have to remember the difference between learning the information in the classroom and getting behind the wheel and actually putting it into practice. The rule says that you stop so many feet before, or you start slowing down so many feet before a stop sign. Getting behind the wheel and actually doing it is different than knowing it. And so those are things that you really need to be looking at when preparing for the exams. How different are RAPs and SoCRA, which are preferable for applying to regulatory jobs? Actually, I think that while SoCRA is accepted, I think that those that really wish to move up and get into the higher positions within the regulatory field, such as those working with the IRB and things like that, I think that the RAPS is a little more difficult to obtain, and also therefore a little more valuable once you've obtained it. So again, but it is not as simple. It is much more complicated than the SoCRA exam. So, and you are required at least to have some type of degree with that. Are sample exam questions available in book form or online module form? Yes, they are. Almost all of them have some, at least 10 of the samples. Then of course, they always offer more if you wish to pay for it. So again, it's up to you as to how you want to go about that. That's where getting into groups is really helpful. Is SoCRA or ACRP needed first or mandatory to apply for RAPS? No. Having SoCRA or ACRP are steps towards RAPS, but no, they are not required. Having that information is valuable. So it could be something that you would get your SoCRA certification first and then start working towards that RAPS. Because the RAPS is going to take a little bit longer for you to acquire all the knowledge that you need and experience. Again, if you have specific questions, I'm always available, not just by, email, but I'm more than happy to set up times to talk with you, look into things and help maybe help guide along the way for some of these specific questions. At this time, I try to present a lot of information in a general format that can apply to 100 and 150 participants. But I understand that there are always the needs of that individual that wants to has a little bit different history and all. So feel free to reach out to me on my email, which I have posted on the screen, and we can set up times to maybe work through how you might be able to work for what you want to get at OSU, and also make sure that your names are then maybe given to those individuals in those areas as someone who is interested in joining their team, because as clinical research grows at Ohio State University, we're always trying to add on. Now, during COVID, please remember that a lot of things have been frozen as far as hiring and moving forward. But hopefully sometime this year, that will start to ease off. Are there any study groups at OSU that would help prepare for the exams? At this given time, I am not aware of any. However, that is something that I stated earlier, that come March and September, I would like to maybe start forming some workshops meaning that they're 25 or less, for studying and prepping for the exams in the spring and the fall. Because I do think that sitting down and discussing questions, putting out scenarios and saying, okay, here's a situation, what would you do, is always helpful to individuals in prepping for these exams, because that's how they word the exam questions. What would the first item be? What would you do first? Or what would be the best answer? And they're multiple choice questions and you have 4 answers there, and all of them would perhaps, what would you do first? You might say, well, you do all of those, but which one do you do first? And so those are the things that they try to really make you to think about, is what are those first steps? Which are the best steps? So, and someone had, Eileen Latimer, basically said that they had formed their own study group in 2006 at OSU. Do we need to register our emails to be added to the list for these workshops and attendance? If you can make sure that Rachel Bergman has your emails, and we will have that from today's session. All of the information will always go out to anybody who has attended one of these sessions. And we'll also send it out and post them on the CCTS newsletter that comes out monthly as well. Because I do think that when we start forming some of those, and if there are those that wish to start forming them now, I am more than happy to take that information and start putting people together. If you wish to do it before March, that's fine too. So I guess if you are interested in joining a group to start a study group for either SoCRA or ACRP or RAPS, or any of the others that I talked about today, just send us an email, a quick email, and just say that you would like to be put into a study group for SoCRA, ACRP, or whatever, and we'll start putting people together. And I will be sure that whenever those dates are set up, to also join, if at all possible, to help guide some of that initially. So when I do the one individual, I do have your email. And so I'll be sending you something. And Eileen, thank you, because if you've already done it before, we can put you in charge of that. I am not the person that says that I have to be in charge of everything. I'm just the person saying, I would love to be able to say that every research professional at OSU, my alma mater, is certified. It's kind of like a magnet status that the nursing staff have. You know, that's that status of quality. And I say that we as Buckeyes always go quality. So I guess I have a passion there. So again, if you have questions, please feel free to reach out. I love helping and guiding. That's why I'm a teacher. And if I don't have the answer, I will find an answer, even if it comes down and that they don't have an answer. Because sometimes when you ask the question is, never thought about that. So again, that's what we're here for. And I really thank y'all for coming in today, well, attending today. And I look forward to working with you, and we'll probably be talking about something with regards to diversity and equity and inclusion, since that does seem to be the hot topic for 2021 at our next meeting, and start looking into some of that and how we can really help push that forward in our jobs every day. So thank you for attending. And with that, I'll conclude today's and we'll follow up with all the questions. Again, copies of today's slides will be coming out because they do have links in it. And feel free to reach out to me for questions. With that, I conclude. Thank you.